According to the results of the case study, the number of overdose cases in people with the same health insurance plan as in people receiving prescriptions. The 16th of July 2019 source: Brigham and Women's Hospital. Access to medicines for family members may be a major risk factor for overdose for people without prescriptions. As shown in a recent study, prescription opioids are associated with the risk of overdose for non-prescription family members. The case study showed that the number of overdose cases almost tripled among people with the same health insurance as those with a prescription for opioids. Prescription opioids are associated with the risk of overdose for family members who do not receive them. The case study shows that the number of overdose cases is almost 3 times higher among people with the same health insurance as among those who receive a prescription for opioids. The researchers found that family expenses for opioids under the same health insurance plan were accompanied by a 2.89-fold increase in the benefits to a person who did not have opioid overdose. Measures may include improved access to opioid antagonists, safe storage of prescribed opioids at home, and better information for patients to reduce overdose among their families. 2017 family members often take naloxone in opioid overdose and should be seen as part of a more general response to avoid fatal overdose of opioids. A combination of opioid overdose and prescription of opioids to family members. Researchers examined only family members of the same caregiver. It is likely that young people who grow up and play with their families will also begin to relieve the burden of daily life.